Hi, my name's Ethan, and I'm joined by Carmela, Katrina, and Abigail to talk about major depression and bipolar disorder. Major depression is a disorder characterized by severe and persistent low mood, profound sadness, and a sense of despair. This is caused by decreased levels of monoamine neurotransmitters in the brain, such as dopamine, serotonin, and norepinephrine. The disorder is very common in society today, as 1 in 7 Australians will experience depression sometime in their lifetime, with 15% of Australians aged 16 to 85 having already experienced it. We're going to cover 2 common methods of treatment, using MAOIs and TCAs. So MAOIs are known as monoamine oxidase inhibitors and were the first antidepressants to be introduced back in the 1950s. As the name suggests, these drugs inhibit monoamine oxidase, which is an enzyme that breaks down various types of neurotransmitters, such as norepinephrine, serotonin, dopamine, and tyramine in the brain. Stopping this breakdown increases the levels of these neurotransmitters and allows them to influence cells that have been affected by depression. The older agents, which are now used as second-line treatment, are irreversible MAOIs, such as phenelzine, tranylcypromine, and isocarboxazid, which can be used to treat major depression. One of the main concerns with these MAOIs is that they interact with food containing tyramine, which cause for users to enforce a diet that strictly prohibits cheese, improperly stored meat, most alcohol, and more. Therefore, reversible MAOIs were developed to inhibit MAO-A, a subtype which primarily binds to serotonin and norepinephrine. By reversibly inhibiting this enzyme, the metabolism and destruction of these common neurotransmitters decrease, therefore improving the symptoms of depression. These drugs, such as moclobemide, can be used as first-line treatment for major depression and have minimal interactions with food. While it already has been approved for clinical use in some Western countries such as Australia, Canada, and the UK, further research of this drug and other potential reversible MAOIs could offer another option of first-line treatment of major depression, which would have a great social impact in cases where other antidepressants have failed.
Moving on to tricyclic antidepressants, which are also known as TCAs, are the second line of defense of antidepressants. These typically act as a noradrenaline and serotonin uptake inhibitor at the sympathetic nerve endings of the brain. In doing so, this causes an increase in their synaptic concentrations and alleviates the symptoms of depression. Various studies have been conducted which compare the effectiveness of TCAs and MAOIs in treating major depression. Kim, Xu, and Amsterdam conducted a randomized comparative trial and found that MAOIs were more effective in treating unipolar major depressive disorder in comparison to TCAs. Based on 147 observations on 94 subjects, they rated the effectiveness of the treatment based on the Clinical Global Impression Severity Score. The higher the score, the more unresponsive the subject was to the treatment. Those who took TCAs obtained a mean score of 4.98, whereas those who took MAOIs obtained a score of 1.04, thus indicating MAOIs were more effective than TCAs in treating depression. However, the interaction between the type of antidepressant and the number of prior treatment trials was significant, indicating that while MAOIs were generally more effective than TCAs for early stage of unipolar major depressive disorder, the added benefit from MAOIs decreased for subjects with a history of more prior antidepressant exposure.
Bipolar disorder is characterized as a manic depressive illness where patients generally experience episodes of severe mood swings from highs of mania to lows of depression. This disorder breaks into 2 subtypes called bipolar 1 and bipolar 2. Bipolar 1 is related to rapid changes of mood and emotional instability, while bipolar 2 is connected to high levels of energy and emotional intensity. The aims for treating bipolar disorders revolve around stabilizing the mood of patients. Lithium serves as a popular drug which treats acute mania and modulates the frequency and severity of mood swings in patients. Its mechanisms include lithium ions permeating through sodium channels and accumulating intracellularly. The sodium and potassium ATPase pump is unable to pump out these ions, which furthermore inhibit agonist-stimulated IP3 formation and blocks receptor-mediated effects. All these mechanisms led to the reversal and handling of cellular stress across brain regions and improve synaptic strength, glial function, and cellular resistance against bipolar disorders. Despite its long history of being deemed an effective drug, blood levels need to be monitored while taking lithium, given its narrow therapeutic index between 0.8 and 1.4 millimoles per liter. Any amount given above 2 millimoles per liter can lead to toxicity and adverse effects such as vomiting, dizziness, or severe tremors.
The safety and efficacy of combined clozapine and lithium treatment is evident in a 2004 randomized clinical trial. Overall, there are 44 hospital patients being monitored for the case study. The treatment duration with combined clozapine and lithium varied. The results provided clozapine was effective within 84%, however, a total of 64% of patients experienced at least one adverse effect. Patients who experienced neurological adverse effects coincided with high dosage of the treatment. Thus, the clinical trial reinforces clozapine and lithium are safe at a moderate therapeutic window. Clozapine can also be used individually to treat severe mania. Clozapine is a second-generation antipsychotic. In comparison to first-generation antipsychotics, the second generation are generally better tolerated and less likely to cause EPS. Antipsychotics are dopamine D2 antagonists, thus apply the mechanism of blocking D2 receptors in various pathways. Clozapine has a higher affinity and activity towards receptors, reducing EPS. Overall, clozapine as a mood stabilizer is effective towards negative symptoms and treating bipolar disease.
Here are our reference slides. Thanks so much for listening.